So our topic is DiGeorge Syndrome. So an overview of what it is, DiGeorge Syndrome is a primary immunodeficient disease. It's also known as 22q11.2 deletion syndrome. It is a congenital disease due to missing a small part of chromosome 22. This deletion results in poor development of several body systems. Common medical problems include heart defects, poor immune system, cleft plate, hypoparathyroidism, and low calcium levels, delayed development with behavioral and emotional problems, and intellectual disabilities. The incidence and prevalence. DiGeorge syndrome is estimated to affect 1 in every 3,000 to 6,000 births. Currently, there's no apparent differences between males and females, and there's currently no apparent differences between racial and ethnic groups. When is this detected? So at birth, if there's several heart defects, a cleft palate, or a combination of factors that is typical for DiGeorge syndrome that are apparent at birth, diagnostic testing will likely begin before your child leaves the hospital. At a well baby visit, if your pediatrician suspects there could be a disorder because of a combination of illnesses and disorders and key features that may become apparent over time during a checkup, the pediatrician may recommend a blood test. For DiGeorge syndrome, the common diagnosis, or to currently get diagnosed, is with a blood test. Symptoms include heart murmur and cyanosis. The cyanosis happens because of poor circulation of oxygenated rich blood as a result from the heart defect, frequent infections, certain facial features such as an underdeveloped chin, low set ears, wide set eyes or a narrow groove in the upper lip, a gap in the roof of the mouth, which is called a cleft palate, or other problems with the palate. Delayed growth, difficulty feeding. Difficult feeding can result in failure to gain weight or issues from the GI-like problems. Breathing problems, poor muscle tone, delayed development, delayed speech, development or nasal sounding speech, learning delays or disabilities, behavioral problems, hypoparathyroid symptoms. Sometimes this could lead to muscle aches or cramps. They can also develop muscle weakness, fatigue, depression and anxiety, or tingling and burning sensation in fingers, toes, and lips.
So here are some photos of the presentations of what a child like this might look like. So in the top here picture, you see that cleft palate deformity, and then down below kind of shows you a little bit more of those facial features that were mentioned above. Now we're going to show you a few videos kind of getting you a little bit more familiar with these types of patients.
For Robin Gramke, a pregnancy was a healthy, happy one. The delivery that followed of her baby girl McKenna also went smoothly.
She came out crying, you know, what normal babies do.
It wasn't until they were getting ready to be discharged that a doctor raised a red flag.
The in-house pediatrician did his final assessment on her and heard the heart murmur, and he came to us and said, I listen to 30 to 40 babies' hearts a day. This is what I do. I do not like the sound of McKenna's heart.
Robin took her daughter to Cincinnati Children's, where doctors diagnosed her with several heart defects, putting her on the fast track for genetic testing. The results showed McKenna has a deletion syndrome called 22q, 22 referring to the chromosome, meaning anywhere from 40 to 70 genes are missing because of the deletion.
It affects everybody differently in the sense that you don't say because you have this condition, you will have all these symptoms. But within it, there are a lot of things that are very similar. It's comprehensive. It kind of messes with every system of the body.
For some, 22q impacts the heart. At 8 days old, McKenna needed her first open heart surgery. Complications followed, and a second heart surgery took place at 25 days old. Airway problems and feeding issues meant more surgical procedures were needed in her first year of life. Adding to the worry and stress, Robin learned the results of her genetic testing. She was surprised to find out she also has 22q, but her symptoms are less severe.
As a mom, I blame myself for her issues. You do go through and you assess everything that you have done when you were pregnant. Like, did I not take my prenatal vitamins like I needed to? I drank a Pepsi, and I probably shouldn't have. You beat yourself up. And all her doctors did say, no matter what you it's not your fault.
Robin came to a level of peace through support from McKenna's medical team and genetic counselors at Cincinnati Children's.
It's about helping people take scientific knowledge and medical knowledge and information and incorporate it into their lives and their hearts and their minds, because none of this happens in a cold clinical way when it's your child. Yay!
McKenna is now 18 months old and her health is improving. She takes daily medications and needs physical and occupational therapy to help get her strength back. While 22q will continue to present challenges, McKenna's mom says her little fighter is in a good place.
It's one day at a time, and don't give your hopes up.
When she was 3 days old, they heard a heart murmur, and they found out she had truncus arteriosus. That kind of guided them that she could possibly have 22q. I was crying. I was devastated because I didn't know what to expect. When we got the diagnosis of 22q is when we then met with a lot of different specialists related to the 22q.
Every aspect of 22q is treatable. The medical conditions are treatable, the cognitive deficits and learning challenges are treatable, and the behavioral differences are treatable.
With Riley, when she was born, she had zero motility in her esophagus. She had surgeries from having a trach to a feeding tube, a G-tube. Those were two major procedures to keep her safe. Early interventions are a huge key reason why she is thriving so much today, 7 years later, after going through everything she did the day she was born.
Vienna received occupational therapy, physical therapy, and speech, and those continued at school. Speech continued, the therapies continued. As she got older, some went away and others continued as resource. So she got help in math and reading, which has been a huge help with her learning and keeping up with her grade. It's been a challenge to navigate all of the appointments with the specialists and also all of his multiple therapies every week. Some moments are harder than others, but it's been good. We have a lot of support from our family, from our church, from our friends.
My name is Daria, and my brother has 22q. 22q is when you're missing a tiny piece on your 22nd chromosome.
I found out that I had 22q when I was 7 years old. You don't need to feel bad about it because other kids and I have it, so it means you're different, and being different is cool.
My son's diagnosis actually evolved over an odyssey that included 27 specialists in 5 years. There were very subtle things going on over time that when you look back, you could say, oh, maybe somebody should have thought of this.
This is a condition that's as common as Down syndrome, and no one's ever heard of it. The 22q and 1.2 deletion occurs because of the structure of the chromosome. It's nothing that the parents did or didn't do that made it happen. Your child is no different at this moment than before you had the diagnosis of 22q.
I'm Jacqueline and I have 22q.
A lot of times we think that another person needs us, but I've learned that I needed Jasmine. And I needed this experience to make me a better person. I needed to be strengthened in the area of patience. And I have been strengthened in the area of patience and understanding. And I've watched Jasmine grow, but it didn't happen overnight.
And she's a good mother because she takes care of me a lot, and I love her.
I think she loves you too.
She does. I always say that every day.
As parents, we are continually encouraged by Bailey's inspiration and her ability to try new things. She is capable and willing to do anything she puts her heart to. If I could go back and tell myself, I would go back and say, it's all going to be okay. You're going to have a happy little girl. She enjoys life.
As time goes on, it's gotten easier. And as time goes on, it gets more complicated too. There are different challenges when they're younger, and there are different challenges when they're older. Once you get through the medical issues, then you can start to deal with some of the educational issues and the social issues. And we've done everything that we possibly can to make him as good as he can possibly be, so to speak, to allow him to grow and mature and to reach any potential he has, which he's got some amazing gifts.
Having 22q is for sure challenging, and I feel that in every challenge I've had, I've always grown up more and I've become stronger emotionally and physically, and I've worked really hard to get to a place in my life, even with the syndrome, a place where I can, be happy and appreciate my uniqueness. I'm Tessa, I have 22q, and I'm a fashion entrepreneur.
I'm a mom, and my son has 22q.
My child has 22q.
I'm a father of a child with 22q.
I am a mother of a child with 22q. So those were some of the physical features, and you kind of get to see a little bit of what the parents and everybody feels with that. So now we're going to go over some of the complications that come along with this disease. So as Amanda mentioned earlier, these patients have that heart defect, which will decrease and make their O2 in their body less efficient, and they have less supplies with that. So some different ways that this happens, which I'll go in more detail with on the next slide, but they could have a ventricular septal defect, a truncus anterior, or a tetralog of Fallot. So these are just different heart defects that kind of make that oxygen not be delivered to the body as well. These patients also often have the hypoparathyroidism, which is too little PTH, which will result in low levels of calcium and high levels of phosphorus. These imbalances lead to seizures, balance problems, kidney problems, heart arrhythmias, stunting in growth, slow mental development in children. They can also lead to a lot of other fatigue-related issues. You also get the thalamus gland dysfunction. This can either be the thalamus is too small or it's completely missing, which can lead to very poor immune function and frequent infections. These patients will also likely have a cleft palate, which is shown up in that right-hand corner there, which will also most likely be fixed after birth. These patients also will have learning, behavioral, and mental problems. It's commonly seen with ADHD. Autism spectrum disorder will also commonly be associated with this. And later in life, patients often have depression and anxiety. They will also have autoimmune disorder. There's increased risk, especially with RA and Graves' disease. So now I'm going to go over some of the heart defects with you that come along with this syndrome.
So we have that ventricular septal defect. It's an abnormal opening or hole in the heart between the pumps, both of the ventricles. So you see that down in this image to the right on the top corner. To the left of that picture that they're kind of put together is what a normal heart would look like. And then we have the truncus anteriosus. It's one large valve leading out of the heart instead of two separate valves coming into the heart. So this will also lead to that decreased oxygen to the body. So you can see that in the bottom right-hand corner. And then we have tetralog of Fallot. All four defects include ventricle septal defects, pulmonary valve stenosis, misplaced of the aorta, or thickening of the right ventricle wall. So that's seen in the bottom right, but towards the middle on the left there. So some general considerations with children with these diseases. A small number of children won't live past the first year solely because their heart defect was so severe. But otherwise, most of these patients live a normal, healthy life. They can go into adulthood with no issues. Children will also likely need extra help within school, both with the developmental delays, some of the cognitive issues, behavioral things, all of that good stuff. And then they might possibly need long-term care with their health. We know that they'll have a poor immune function, so this could lead to that. So some general treatments for these patients. We know that they have heart defects, so these will be surgically repaired as soon, if not immediately after birth. Usually once they're found, they're fixed and gone about properly. The hypoparathyroidism, they will be treated with calcium and vitamin D supplements. And then the thalamus issues will be regulated with vaccines, making sure they're getting their annual flu shots and all of that good stuff. In severe cases, they might get a transplant of thalamus tissue to kind of help rebuild that immunity. The cleft palate, like I mentioned earlier, will be surgically repaired after birth. And then they'll have the developmental delays, is just where we come in as physical therapists, and they will also be seeing most likely an occupational therapist and a speech pathologist.
So the biggest thing to be aware of with special considerations with assessment is each one of these patients is going to present a little bit differently. There's not any set in stone symptoms that are going to come along with this. And so you really want to just do a full systems review, look at everything. You want to look at their cardiac function, and even though a lot of these defects are going to be fixed right at birth, you want to still be aware of the cardiac considerations. Hypoparathyroidism can lead to your patient having seizures, weakness, fatigue, increased muscle soreness. And you also want to be aware that a lot of these patients are going to have some developmental delays, whether that's physically, functionally, or cognitively, or all three of them together. So, plan of care and treatment. This is going to be highly multidisciplinary approach. You're going to need a lot of different people, and they might not be seeing all of these different specialists throughout their all the time, but they might see them a little bit here and there. So you're going to have cardiologist and a cardiac surgeon, ENT, which is ears, nose, throat, immunology, genetics, speech therapy, especially if they have that cleft palate abnormality, and then physical therapy as well to address some of the developmental delays and weakness. So our plan of care continued. How can PT help? So again, each one of these patients is going to be a little bit different. So physical therapy is really going to have to look at the deficits that each children is presenting with. But a big thing that we might help with is achieving some of those milestones, especially if they're going to be delayed. So with rolling, sitting, standing, cruising, walking, all of those. Because of their hypoparathyroidism, just work on strengthening activities as well. And these kids also might have some balance issues, so work on balance training, work on some of those postural muscles as well. And then family and social considerations. This is a immune system compromising disease, and so kind of educating the family on it's important to get your annual vaccinations and your flu shot. It's good to be mindful of cleanliness and wash your hands. If your baby's, down playing on the floor, it might not be the best if they just pick anything up and put it in their mouth. So just kind of educate on some of that infection prevention measures. You also might want to educate on some of the hypoparathyroidism, like let them know, hey, seizures could be an option. They might have some balance issues, weakness. They might complain of muscle soreness for longer. And another one that Jenna had kind of hit on earlier was some of these kids might need some extra help in school. And so kind of giving them some of those resources of these are some people that you can talk to within the school to get extra help with math or reading or whatever it might be that your child is struggling with. And here are our references. If you have any questions, feel free to ask us in class.